everyone to today's conference call. At this time, your lines are on listen only for today's conference until the question and answer portion of our call, at which time you will be prompted to press star one on your touchtone phone. Please ensure that your line is unmuted. Please record your name and affiliation to be introduced to ask your question. Our conference is being recorded. If you have any objections, you may disconnect at this time. I will now turn conference over to our host, Ms. Shirley Simpson. Ma'am, you may proceed.
Good morning and welcome to this U.S. Food and Drug Administration media briefing on the agency's proposal to improve access to hearing aid technology. I'm Shirley Simpson with the FDA's Office of Media Affairs. In a moment, I will turn it over to HHS Secretary Javier Becerra for opening remarks. Following Secretary Becerra, Acting FDA Commissioner Dr. Janet Woodcock and Dr. Jeff Shuren, the Director of the FDA's Center for Devices and Radiological Health, will also provide brief remarks. After the remarks, we will move to the question and answer portion of the call. We also have Dr. Eric Mann from the Office of Ophthalmic Anesthesia, Respiratory, ENT, and Dental Devices, who's on the call to help answer specific questions. Reporters on the phone will be in a listen-only mode until we open the call up for questions. As a reminder, this audio call is being recorded and live streamed on the FDA's YouTube channel. Please ensure questions pertain to today's announcement and limit yourself to one question and one follow-up so we can get to as many questions as possible. With that, I would now like to welcome HHS Secretary Javier Becerra to our call.
Shirley, thank you very much, and good morning, and welcome to everyone who's joined. Thanks for taking the time to be with us. I also want to thank Commissioner Woodcock and Director Shuren for the work they've done and for allowing me to join with them. As many of you are probably aware, one of the priorities here at HHS has been to reduce healthcare costs and expand access to high-quality healthcare services. That's something that was made very clear by then candidate Biden, and now President Biden, that we do everything we can to try to make healthcare more affordable and accessible. So today's announcement goes right up that alley. President Biden in July issued an executive order on competition. It called for us to propose a rule allowing hearing aids to be purchased over the counter, so you wouldn't have to need a prescription to get it. You wouldn't have to necessarily go to an audiologist to get the instructions to get that. And today, our partners at the FDA are delivering on the President's request. For some 30 million Americans who suffer hearing loss, safe, effective, and high-quality hearing aids are way too often out of their reach because of the price tag. I say that not just as Secretary of HHS, I say that as the son of a mother who has had to go through a number of hearing aids and is still out several $100s trying to get it back from one of the manufacturers of these hearing aids. It's a very frustrating and thankless task. On top of that sticker shock that many have faced, navigating for the best options out there can sometimes be very, very difficult. It got to the point where my mom had to turn to her children to try to help her navigate this process. Too often, patients have needed to make an appointment with a doctor or a hearing specialist to receive a hearing aid. And with today's proposed rule, that we would usher in a new system of over-the-counter options. We open the door to an easier process and a more affordable process for people to have access to good quality hearing aids. Today's action by the FDA takes us another step closer to the goal of making hearing aids more accessible, more affordable for tens of millions of people. And here I want to make sure I emphasize, we're doing this for folks who have experienced mild to moderate hearing loss. Obviously, if the hearing loss has been very severe for someone in your family or loved one, chances are they have to see a specialist. But for those who have experienced mild or moderate hearing loss, this is going to be great news for you. Equally important, this allows us to put hearing devices more in reach of communities that have often been left out. Communities of color, the underserved, have typically and traditionally lacked access to hearing aids. And I think this move is also going to unleash innovation. It'll foster competition among hearing aid manufacturers. It'll encourage companies to develop new devices that really are catering to consumers. So it's consumer choice that will drive what's out there in the market for people to get. And so this is good news. And I want to thank the team at FDA, Commissioner Woodcock and Dr. Shuren will be speaking on behalf of the FDA. But I certainly want to thank everybody that was behind this proposal to put this rule out. And I now turn it over to Acting FDA Commissioner, Dr. Janet Woodcock. Dr. Woodcock?
Thank you, Secretary Becerra. We really appreciate your joining us for today's announcement. Now, the proposed rule the FDA is issuing today will establish a new category of over-the-counter hearing aids. When finalized, the rule would allow hearing aids within this category to be sold directly to consumers in retail stores or online without first undergoing a medical exam or custom fitting by an audiologist. This landmark proposal is designed to help ensure the safety and effectiveness of over-the-counter and prescription hearing aids, but as well as increase competition in the market, as the Secretary said, improving access to hearing aid technologies for the American public by making them widely available across the country. Hearing loss can have a profound impact on daily communication, social interaction, and the overall health and quality of life for millions of Americans. The approximately 38 million Americans 18 and older who report some trouble with their hearing, this can significantly impact communication with others, personal relationships, school or work performance, and emotional health. And there are a number of different causes for hearing loss, including aging, exposure to loud noises. For those of you who go to loud concerts, take this in mind, and certain medical conditions or other factors. And despite the high prevalence and public health impact of hearing loss, only about a fifth of people who could benefit from a hearing aid are currently using one. And this is because, as you heard, there are many barriers to people getting access to a hearing aid. So today's proposed rule represents a significant step forward in helping provide adults who have mild to moderate hearing loss with improved access to more affordable and innovative product options. This proposed rule, when finalized, would allow them to have greater control over their hearing aid purchasing decisions at stores nationwide or online without a professional hearing exam, fitting adjustment, or a prescription. In addition, today, the FDA has issued an updated draft guidance on hearing aid devices and personal sound amplification products, or PSAP. Hearing aids and PSAP both affect an individual's ability to hear sound, but the products have different intended uses and are subject to different regulatory controls. And this is easily confused. When finalized, the updated guidance will clearly describe the difference between hearing aids and PSAP and clarify the regulatory requirements for each of these product categories. Today, these actions reflect the FDA's commitment to lowering barriers to access, providing people with greater choices at lower prices, and helping to facilitate innovation in hearing aid technology. And with that, I'd now like to turn to Dr. Jeff Shuren, Director for the Center for Devices and Radiologic Health, to expand on this. Dr. Shuren.
Well, thank you, Dr. Woodcock. The proposed rule the FDA is announcing today is designed to facilitate easier access to hearing aids and encourage people with hearing loss to seek additional interventions. By taking this step to establish a new regulatory category of over-the-counter hearing aids as authorized by Congress, the agency aims to address existing barriers that prevent the use of these devices, and this includes cost, access, social stigma associated with hearing loss, perceived value of the devices, as well as certain state and federal regulations. The proposed rule, when finalized, will also amend existing rules that apply to hearing aids for consistency with the new over-the-counter category, repeal the conditions for sale to hearing aids, and address state regulation of hearing aids. The new over-the-counter category would apply to certain air conduction hearing aids intended for adults aged 18 and older who have perceived mild to moderate hearing loss. Air conduction hearing aids are worn inside the ear and amplify sound into the ear canal. Hearing aids for severe hearing loss or for users younger than age 18 would remain as prescription devices. To ensure patient safety, the FDA is proposing a maximum output or sound volume limit for over-the-counter hearing aids that's intended to prevent over-amplification of sound. The proposed rule also includes certain device performance and design requirements, such as distortion control limits, self-generated noise limits, latency limits, how quickly an over-the-counter hearing aid processes, amplifies, and relays a sound, the range of frequencies that the device can reproduce, and how uniformly the over-the-counter hearing aid amplifies different frequencies over its bandwidth. In addition, the proposed rule includes a requirement to limit the insertion depth of the device, how far the hearing aid can go into the ear canal. Furthermore, the proposed rule specifies labeling requirements for over-the-counter hearing aids, including minimum user age limits, how to report adverse events, warnings, and other important information, and conditions or symptoms of hearing loss that should prompt a consultation with a hearing healthcare provider. The FDA has worked diligently to draft the proposed regulations in the midst of its unprecedented efforts to address the COVID-19 pandemic. Issuing the proposed rule has been a top priority for the FDA, and the agency will work to ensure that the appropriate safeguards are in place to make the over-the-counter hearing aids a safe and effective option for consumers. The updated draft guidance for hearing aid devices and personal sound amplification products, also known as PSAPs, will describe what these devices are and outline the regulatory requirements for each. PSAPs are intended for people with normal hearing to amplify sounds in certain environments, such as for hunting or other recreational activities like bird watching. Now, while hearing aids and PSAPs both amplify sound for the user, PSAPs are not intended to aid persons with or compensate for impaired hearing. Such PSAPs are not medical devices and not regulated by the FDA. The draft guidance, when final, will also provide clarity on the difference between PSAPs and hearing aids and make clear that PSAPs are not considered over-the-counter alternatives for hearing aids. Manufacturers making claims or statements suggesting that their products may be used for hearing loss must comply with all applicable regulatory requirements for medical devices, including those specific to hearing aids, to market their devices legally. It's our belief that these two actions will help encourage additional innovation in the field of hearing aid technology. When finalized, the proposed rule will allow consumers to purchase over-the-counter hearing aids from a wider variety of retailers, as more options for hearing aid models are available to them at potentially lower costs. By improving access to safe, effective, and potentially more affordable over-the-counter hearing aid options, millions of Americans who suffer from hearing loss will have an opportunity to improve their hearing health. And thank you. And now I'm going to turn it back over to the moderator to begin questions and answers.
Thank you, Secretary Becerra, Dr. Woodcock, and Dr. Shuren. At this time, we will begin the question and answer portion of the briefing. As a reminder, this call is being recorded. When asking a question, please state your name and affiliation. Also, please ensure questions pertain to today's announcement and limit yourself to one question and one follow-up so we can get to a number of questions. Operator, we'll take the first question, please.
Thank you. Our first question is from David Lim with Politico. Your line is open, sir.
Hi, thanks for taking my question. From my read of the proposed rule, it appears that over-the-counter hearing aids will have to go through the 510K pathway to be marketed. One, is this correct? And then second, given the 90-day comment period on the proposal, the 60-day implementation timeline once an eventual final rule is published, when does the agency expect OTC hearing aids to be available to consumers?
Well, thank you for the question. First off, the proposed rule does not change how we oversee the safety and effectiveness of hearing aid products. That said, we do anticipate that most of these over-the-counter hearing aids would be under 510K if they are self-fitting hearing aids. As to when ultimately we will move forward for finalizing, this remains a top priority for the agency. And once the comment period closes, we will expeditiously move forward to finalize the regulation. At that point, we're proposing 60 days then to implementation. And for any new products coming on the marketplace, it has to meet those requirements at that time. For any that are currently on the marketplace and need to make changes, they'll have 180 days for transition. That's what we're proposing.
So when do you think a hearing aid will be able to be bought by a consumer under this new category?
Well, first, let's hear from the public as to whether or not what we're proposing is right, and we'll take all of that feedback into account and then move forward on the regulations. I can't speculate on time, but it is a top priority for HHS and the FDA and the administration.
Operator, we'll take the next question, please.
Thank you. Our next question is from Matt Perrone with Associated Press. Your line is open.
Hi, thanks for taking our question. As you said, these are only going to be for people with mild to moderate hearing loss. How is someone going to self-diagnose to be able to tell if one of these devices will be sufficient or if they need a prescription strength device? I mean, that's one of the arguments I think we've heard from audiologists for many years, that you need someone with professional expertise to perform this exam and pick the right device.
Well, thank you for the question. The regulation lays out those conditions where a consumer should go ahead and seek medical care. It's things like deformities of the ear, if someone is bleeding, they have pain or discomfort, and we provide a number of other factors to assist consumers in determining whether or not they should seek medical attention. But there are millions of people today with mild to moderate hearing loss who could benefit from the availability of over-the-counter hearing aids. As you've heard, too, so many people who could benefit are not taking advantage for a variety of reasons. And this rule is designed to address those barriers, facilitate the availability of more options that are more affordable to help millions of consumers.
Operator, we'll take the next question, please.
It comes from Nick Florco with STAT. Your line is open.
Hi, thanks for doing this. Attorneys general and advocacy groups have raised concerns in the past that companies were already selling hearing aids that they claimed were available over the counter. I feel like this shows that companies sort of aren't willing to wait for FDA clearance here. And so I guess I'm wondering, how will the FDA deal with these manufacturers, and how can the FDA ensure that substandard devices or unscrupulous manufacturers aren't using this new rule as sort of carte blanche to sell their products and claim that they're OTC hearing aids?
Well, thank you for the question. First off is having the regulation out there. So we are very clear as to what criteria need to be met to be an over-the-counter hearing aid. And we lay out explicitly what are expected for performance and adjustability. For those products that are not in conformance, we will go ahead and take appropriate actions so that they're not being sold on the marketplace inappropriately. The rule does put in place lots of different patient safeguards that lays out expectations on what we expect to see from these hearing aids and is very explicit in those requirements to ensure the safety and effectiveness of these products. But again, we're putting this out as a proposed rule, and we very much welcome feedback from our external stakeholders.
Can I just ask, assuming this is finalized, what will for the FDA's oversight of the market look like? Like, can you walk us through a little bit of how you will ensure that the hearing aids available OTC are conforming to the standards that you lay out in this rule, assuming that it's finalized?
Oh, thank you. Well, for those hearing aids, over-the-counter hearing aids that are self-fitting, and we're anticipating that many of these are going to be the self-fitting, they will come in and have a review by the FDA. will have important controls and safeguards out there regarding performance and adjustability. We will continue to monitor what's available on the marketplace. We continue to receive mechanisms for the public to provide feedback on products that are available in the marketplace. We do our own monitoring as well. And if we find issues, we will take appropriate follow-up. Thank you.
Before we go to the next question, can I just add something here? And I say this more from the perspective of a former Attorney General for the largest state in the nation. There is a need to make sure that what we do will be consumer friendly, and there are some technical issues that do have to be addressed in order to make sure that consumers don't get confused and end up being hoodwinked or driven down a rat hole when it comes to what they bought and trying to get their money back. So I think we recognize that. I consider this a very important rule because it makes a hearing aid more readily accessible to people, especially those with mild or moderate hearing loss. And it puts something within their reach at a far better price. But no doubt, we're going to have to make sure that we're very careful in what we do and how we both implement and enforce, because what we don't want is for people to be sold by those who would claim that they now have FDA approval. There's some kind of good housekeeping seal of approval to what they do, and ultimately they defraud consumers even more. So we're going to be very careful, but there's no doubt that for millions of Americans who could use a hearing aid, this will be a lifeline to better days by being able to hear more. So we're going to be very cautious, and I just wanted to add that exclamation point on this because we understand what can happen in the marketplace if we're not careful. Over.
Operator, we'll take the next question, please.
Thank you. It's from Phil Galowitz with KHN. Your line is open, sir.
Hi, thank you for taking my call. As a top FDA priority, can you talk about why this took over 4 years to write the regulations? I realize we had the COVID pandemic start 20 months ago, but even before then, there were questions of the length of time. What was the difficulty? What was the challenges? And how unusual is this for the FDA to take 50 months to write a regulation?
Well, thank you for the question. Regulations do take time, and we wanted to get feedback as to setting the appropriate performance criteria. Congress put in for us to issue the rule. Actually, it was for August of last year, and this was a priority we were moving forward on. But again, the COVID-19 pandemic occurred. That was an all-hands-on-deck 24/7 undertaking, still is. But we have been still moving the rule forward and issuing it today. And as I said, too, after the public comment period closes, we'll move forward to quickly finalize it.
You said August of last year. I thought it was August of 2017 that the law passed.
Oh, the law passed, but Congress put in for us to issue the rule by August of 2020, understanding that it would take time to go through and develop the right specifications and go through rulemaking to put out the proposed rule.
And this is Javier. Again, I can only speak for the time that I've been here and been able to work with Dr. Woodcock and her team, but I can tell you that they've been very busy trying to get this proposed rule out. But as you can tell from news today involving the FDA that goes far beyond over-the-counter hearing aids, they have been really busy. And during my watch, I don't think there's been a day when Dr. Woodcock and her team haven't had something front and center that is not only life-threatening but also globally important. So I know that during the time that I've been at HHS, they have worked admirably to try to get this done.
Operator, we'll take the next question, please.
Thank you. Our next question is from Catherine Roberts with Consumer Reports. Your line is open, ma'am.
Thanks for taking my question. I just wanted to follow up on the question about sort of the warnings from attorney generals and things about online hearing aid sales. I know there are a number of companies currently selling, plain old wireless air conduction hearing aids online right now. So I just want to get clarity. Will those companies be basically forced to turn their products into OTC hearing aids under this new rule, or will they technically be able to basically continue selling their hearing aids direct to consumer online without coming into compliance? Does that make sense?
And I'll turn over to Dr. Mann to address this question.
Hi, this is Eric Mann. So we are aware that there are some manufacturers that are currently marketing their devices as OTC hearing aids or as PSAPs, when in fact, their intended use and their labeling and everything suggests that they are in fact hearing aids. So we do know that this is going on out there. If in fact they were marketing themselves as a hearing aid, they were in violation of the FDA regulations regarding hearing aids at that time. So they had the choice of either coming into compliance with the current, with the new OTC regulations, or alternatively, they would need to alter their labeling so that they no longer have labeling that suggests that they are a hearing aid.
Okay, thank you.
Operator, we have time for one last question.
Thank you. Our last question will be from Emily Kopp with Roll Call. Your line is open.
Hi. Hoping you could elaborate on the amplification cap. Could that limit the utility of over-the-counter hearing aids to some folks? And if so, why is that important?
Well, thank you. I'll turn that over to Dr. Mann as well.
So I think the question was about amplification limits. And this is something that we've really considered very carefully in terms of crafting these proposed rules for over-the-counter hearing aids, because we know that there is a risk of over-amplification and inducing a noise-induced hearing loss if it's too loud. But we've also kind of strived to achieve a balance where there's a safe output limit, but the hearing aid will still have enough power to amplify sounds for people with all the way up to moderate hearing loss. So we based those limits in the proposed rule on a voluntary consensus standard for PSAPs, actually. But we've reviewed that standard, and we think that it's applicable and relevant to hearing aids. And it's sort of based on the NIOSH National Workplace Guideline, and it's based on amount of how loud it is and the duration of exposure. So we think that's an appropriate starting point in terms of the limit. We've also received feedback from the NASM workshop, as well as public comments to several dockets that we have had here at FDA. So I think we've really carefully thought about this to, again, strike that balance between an appropriate output level that is safe, but still will allow people with perceived moderate hearing loss to achieve benefit. But we do welcome input from the public on that.
Thank you, everyone. This concludes today's media briefing. A replay will be available on the FDA's YouTube page. The FDA's press release has been posted on the agency's website. If you have follow-up questions, please don't hesitate to contact the FDA press office at fdaoma@fda.hhs.gov. Thank you and have a great day.
This does conclude today's conference call. We thank you all for participating. You may now disconnect and have a great rest of your day.